Hello guys, welcome to Nursing Made Easy, a platform where you get easy but comprehensive nursing presentations. If you want me to make presentation on any specific topic, then please let me know via inbox or comment section below. Today, our topic of discussion is communicable diseases. So first we need to understand the certain terminologies related to communicable diseases. The first one is, what is disease? The definition of disease refers to a disorder of structure or function in a human, animal or plant, especially one that produces specific symptoms or that affects a specific location and is not simply a direct result of physical injury. A very long definition. So, for better understanding, I will divide this definition into two parts. The first one is, disease is a disorder of structure or function in a human, animal, or plant which produces specific symptoms in a specific location. So, guys, basically, human body is made from specific structures and it is designed to perform specific functions. When there is any disruption in the structure or function of human body, it produces symptoms. This disruption in normal anatomy or physiology is called as disease. For example, in asthmatic patients, the person who is suffering with asthma, the affected organ is lung. So we can say that there is disruption of normal structure and function of lungs. In that case, that lung produces specific symptoms. These symptoms includes anxiety, chest tightness, and specifically shortness of breath. The second section of this definition is, it is not simply a direct result of physical injury. Basically, disease can be occurred via mechanical, biological, or any physical injury. So, only physical injury like road traffic accident, fall, blunt injuries are not in the category of disease. We can say that disease is anything which causes disruption in the normal anatomy and physiology of human. The second terminology we are going to review is source of infection. Source. Source is a word which means a route, a pathway, a via. So, source of infection simply means a person, animal, or object from which an infectious agent is passes to the host is called as source of infection. The second one is better understand. The third terminology is reservoir of infection. Any person, animal, plant, arthropod or soil in which an infectious agent lives and multiplies, on which it depends for survival and reproduction, is reservoir. Guys, you need to differentiate between the two. Let me repeat. Source of infection is something, the via, the pathway through which an infectious agent passes to the host, while the reservoir is the living place, is that place where the infectious agent lives for survival. That place can be anything, a person, animal, plant, or arthropod. Here is a tabulated example of sources and reservoirs along with their diseases. For example, tuberculosis has a reservoir, men, and source is sputum. Sputum is the source through which the infectious agent passes from one person to another through coughing and sneezing. AIDS reservoir is men, while the source is body secretions and fluids. So you can see that there is 8-9 diseases with their reservoir and source. I hope you can now differentiate what is the reservoir of infection and what is the source of infection. Now, our main topic is communicable disease. As the name indicates, a disease which can be transmitted from one person to another, from a reservoir to a susceptible host, like tuberculosis, is called as communicable disease. Now, what is the mode of transmission? How the communicable disease is transmitted? Basically, the mode of transmission is divided into two: the direct mode and the indirect mode of transmission. We are going to study these two modes in detail in the next slides. The first mode is mode of transmission via direct transmission. Direct transmissions has five further types: direct contact, droplet infection, contact with soil, inoculation into skin or mucosa, and transplacental. While the indirect transmission is divided again five subtypes: vehicle borne, the vector borne, airborne, fomite borne, and unclean hands and fingers. So guys, we are going to study all these types and subtypes one by one. Please listen carefully for better understanding. Direct transmission, the first one is direct transmission, an immediate transfer of infectious agent from the source or reservoir to a host, such as direct contact from skin to skin, mucosa to mucosa, etc. Examples includes AIDS, leprosy, skin and eye allergies. As the definition indicates that this type indicates when there is direct immediate contact between the two one, the infectious agent and the host. The best example is AIDS, leprosy, eye allergies and skin infections. The second type is droplet infections. As the name indicates, this is a direct spray of droplets of saliva or nasopharyngeal secretions during coughing, sneezing, taking, etc., talking. Example, common cold, tuberculosis, diphtheria, whooping cough. All these diseases fall in the category of droplet-borne infections, in which the two persons, if they are talking, if they are sneezing, if they are coughing even, they can transfer infectious agents via their droplets from one person to another. The third type of direct transmission is contact with soil. The disease agent is acquired directly from soil, like tetanus, hookworm, and larva, because these three basically are present in the soil, and when a person fall, like in road traffic accidents, history of falls, these people get direct contact with soil and acquired such type of infections. The fourth one is inoculation into the skin. The disease agent is inoculated directly into the skin or mucosa, that is rabies, by dog bite, or hepatitis B by contaminated needles or syringes. Inoculation means when something is going to break the skin barrier and directly inserted into the body. The best example is the dog bite, hepatitis B via contaminated needles or syringes. The transplacental is, as the name indicates, disease agents that directly transfers from mother placenta, like AIDS and hepatitis C. This is these guys, you can see that these pictures are basically indicating the direct contact via kissing, via touching the hands. These are representing the examples of direct transmission. Now guys, let's move towards indirect transmission. Indirect transmission, as the name indicates, a type of transmission in which the infectious agent and the host are not in direct contact, but there is certain types of vias, pathways through which infectious agent is passed to the host. The first one is vehicle-borne transmission of infectious agent through water, food, ice, blood, tissue, organs. That is vehicle-borne. Vehicle, like a vehicle in daily routine we use for transportation. Similarly, the name indicates that transmission of infectious agents through the vehicle like water, food, ice, blood, or tissue or organs. Diseases by water and food are diarrhea, hepatitis A, cholera, polio, food poisoning, etc. And with blood are hepatitis B, syphilis, organ transplantation. You all know that cholera, diarrhea, hepatitis A, all are the waterborne diseases. The next one is vector-borne. In arthropod, mosquito, flies, or any living carrier that transfers an infectious agent to a susceptible host as malaria, plague, and bats. Basically, in vector-borne diseases, the flies and mosquitoes are the carrier of infectious agents, which transfer it from one person to another. The airborne is situations where droplet nuclei, residue from evaporated droplets, or dust particles containing microorganisms can remain suspended in air for long periods of time. Examples: tuberculosis, chickenpox, and measles. Okay, guys, you need to differentiate between the airborne and droplet borne. Many times, students are confused between the two one. Remember that the droplet one is the source of disease transmission in which there is direct contact between the host and the infectious agent through coughing, sneezing, talking, etc. But the airborne is that mode of transmission in which the droplet nuclei remain suspended in the air for a longer period of time, and the person who is inhaling in that air can get affected from the infectious agent. Fomite-borne, basically these are the inanimate articles or substances other than food and water contaminated by the infectious discharges and capable of transferring them to a healthy person, like cloths, towel, cup, spoons, toys, syringes, etc. The diseases through which spreaded are the diphtheria, typhoid fever, diarrhea, and skin infections. Basically, the fomite-borne, as the name indicates, are the disease mode of transmission in which the inanimate objects became the via of disease transmission. Unclean hands and fingers. Hands are the most common medium by which pathogens are transferred to food from skin, nose, bowel, etc. Examples are hepatitis A, dysentery, and typhoid fever. Here you guys can see the picture A, in which the fly picks up pathogen from the fecal matter and carries it on its body. The second one is fly transfers pathogen to food. Person eats contaminated food and then gets sick. Basically, in that case, this is the vector-borne disease. Example of vector-borne disease in which the fly picks up the infectious agent from the stool and it transfers it to the food, and the person eating the food gets infected with the food. The picture B also indicates the same. Infected mosquito bites the infected person, and when this infected mosquito bites the healthy one, it transfers its infection to the healthy person. So this is all for today, guys. I hope you better understand what is now communicable disease, the source of infection, reservoir of infection, and the different modes of disease transmission. Please stay tuned. In my next video, I am going to explain the different communicable diseases. Thank you so much. Allah Hafiz.